Welcome to Canada's largest mental health teaching hospital and one of the world's leading research centers in its field. Before we begin, I would like to acknowledge that CAMH is situated on lands that have been occupied by First Nations for millennia, lands rich in civilizations with knowledge of medicine, architecture, technology, and extensive trade routes throughout the Americas. In 1860, the site of CAMH appeared in the Colonial Records Office of the British Crown as the council grounds of the Mississaugas of the New Credit, as they were known at the time. Today, Toronto is covered by the Toronto Purchase Treaty No. 13 of 1805 with the Mississaugas of the Credit. Toronto is now home to a vast diversity of First Nations, Inuit, and Métis who enrich this city. CAMH is committed to reconciliation. We will honor the land through programs and places that reflect and respect its heritage. We will embrace the healing traditions of the ancestors and weave them into our caring practices. We will create new relationships and partnerships with First Nations, Inuit, and Métis, and share the land and protect it for future generations. I am very pleased to welcome back the Honourable Sylvia Jones, Ontario Deputy Premier and Minister of Health, and the Honourable Michael Tibollo, Ontario's Associate Minister of Mental Health and Addictions. Both ministers visited CAMH at the end of February with Premier Ford to break ground on two new CAMH buildings, the Temerty Discovery Centre and the Secure Care and Recovery Centre. We've made great progress since that time, hence the noise and the dirty windows, and we look forward to welcoming you back to mark more construction milestones on these important projects as they move forward. I also want to acknowledge and welcome the many CAMH staff, physicians, board members, supporters, mental health advocates, and experts who are with us in the room today and tuning in via live stream. We are standing in the McCain Complex Care and Recovery Building. This new facility was opened in the middle of the pandemic, and it is here, right above us, that our teams provide world-leading crisis and complex mental health and addictions care. This space was designed to integrate CAMH within our surrounding community, to add architectural interest to Queen Street West through the thoughtful design, incorporation of art, and in its transparency. This facility and all of CAMH's buildings show the world that we should not be ashamed of mental illness. Even better, it tells people to come on in if you or a loved one needs help. It is particularly touching that we are gathered here during Mental Illness Awareness Week. The stats are staggering and humbling. Here are but a few. By the time Canadians turn 40, 1 in 2 have or have had a mental illness. Every day, 20 people in Canada die from toxic drugs, and 11 people die by suicide. The second leading cause of death in young people is suicide. And according to the 2023 Ontario Student Drug Use and Health Survey, 1 in 6 high school students in Ontario have seriously contemplated suicide in the last year. 1 in 5 students also report harming themselves on purpose in the past year, and 51% indicate a moderate to serious level of psychological distress, which are signs of anxiety and depression. The kids are clearly not okay. And one of the things that makes mental illness such a big deal is that for the most part, these illnesses start in childhood. 50% of mental health problems are established by age 14 and 75% by age 24. In other words, CAMH, with over 500 mental health beds, is primarily full of people who developed chronic mental illness in their youth that we didn't access in time or in the right way to give them hope for recovery. And adolescence in particular is such an exciting time, but it is also a high-risk time for the onset of a mental illness. And understanding this gives us clear windows in time into which we can make interventions. We have an opportunity to engage sooner, to change and even possibly reverse the course of mental illness. That means we need to get upstream and intervene earlier. And without preempting today's announcement, you'll hear about one such evidence-based treatment that we know will make a huge difference. I'm looking forward to continuing to work with our Ontario government and community partners to improve the lives of those who are the most in need, so that we may work towards a world where everyone believes that life is worth living. And now it's my pleasure to invite the Honourable Sylvia Jones, Ontario's Deputy Premier and Minister of Health, to the podium. Over to you, Minister.
Well, thank you very much, Sarah, and good morning, everyone. It is indeed great to be back at the Centre for Addictions and Mental Health, or CAMH, today, alongside my colleague, Michael Tibollo, the Associate Minister of Mental Health and Addictions. Just a few months after our government celebrated the groundbreaking of the new Secure Care and Recovery building here at CAMH. To share one more way our government is making it easier to connect to mental health care and support. On behalf of Premier Ford and our entire government, I want to thank the entire team at CAMH for hosting us today during Mental Illness Awareness Week, and for everything you do to provide exceptional mental health care and support to people and families across Ontario each and every day. Under the leadership of Premier Ford, our government has been making record investments to build a world-class health system that puts people at its heart, by making it easier for people and families experiencing mental health challenges to connect to the treatment, care, and support they need when and where they need it. Through our government's Roadmap to Wellness, we are investing $3.8 billion over 10 years to fill gaps in mental health and addictions care by creating new services and expanding programs. And we are not stopping there. As part of our 2024 budget, we're investing an additional $396 million over 3 years to improve access to services, including by creating up to 500 more addictions recovery beds and new mobile mental health clinics through the Addictions Recovery Fund, expanding access to supportive housing to assist those experiencing mental health and addictions challenges, and growing our Youth Wellness Hub network with 10 new hubs, bringing the total to 32 across Ontario. We continue to connect more people at every stage of life with the right care at the right time. Today, our government is announcing a $19 million investment to expand the provincial early psychosis intervention program, ensuring those experiencing some of their first mental health challenges can connect to the care they need earlier on their journey to wellness. The Early Psychosis Intervention, or EPI, program works to identify early psychosis in those aged 14 through to 35, to provide them with timely, individually tailored, and age-appropriate treatment to support symptomatic and functional recovery, such as returning to school, to work, and building social relationships. The expansion of this critical program has been made possible through a partnership with the Slate Family Centre for Youth in the Transition at CAMH. This partnership will build system capacity to deliver standardized, evidence-based care across Ontario. Expanding targeted services like EPI is another way our government is improving access to mental health support services that better reflect the needs of people and their families who are experiencing mental health challenges, connecting thousands of people across Ontario to the care they need when they need it. Thank you again to CAMH and all the partners who have come together to support the growth of this important program, and for your ongoing work to deliver world-class care and support to people and families in our communities. Our work does not stop here, and I look forward to our continued collaboration to better support people on their journey to recovery and wellness, and hearing about the impact of this expanded program. I will now pass it over to Associate Minister Tibollo to share a few words. Thank you, and stay well.
Thank you, Minister Jones, and good morning, everyone. It's a pleasure to be back at CAMH this morning to kick off Mental Illness Awareness Week with this important announcement. As the Minister said, today we're providing a significant boost in funding for the Early Psychosis Intervention Program. As everyone here at CAMH will know, when someone experiences first episode psychosis, it's crucial that we help that person get treatment as soon as possible. When we get to people quickly, we dramatically improve their long-term prospects and quality of life. And that's what this announcement is all about. To be afflicted by psychosis is a terrible thing, and the stigma of insanity has prevented far too many people from seeking and receiving help early when it can be most effective. As I've said many times, the era of stigma is over. Mental illnesses are not things that can or should be ignored, and people suffering with them deserve the same care that anyone with a physical illness does. And like physical illnesses, we know that the best mental illness is one that never develops or that we catch early on. Prevention and early intervention are so important, not just for individuals, but for the entire healthcare system. By making upstream investments like these now, we're going to help save people from a lifetime of terrible struggle and save our hospitals and emergency rooms from a lifetime of treating them. I want to end by saying a huge thank you to the staff and leadership at CAMH for hosting us this morning and for their incredible and tireless work they do for some of the most vulnerable people in this province. You really are one of the jewels in the crown of our healthcare system, and we could not ask for a better partner as we continue our work to improve mental health and addictions care for the people of Ontario. Thank you again to everyone for being here this morning, and I hope you all have a wonderful rest of your day as well. Thank you.
Hi, I'm Dr. Aristotle Voineskos. I'm the Senior Vice President for Research and Science, and really wanted to thank Minister Tibollo and Minister Jones for this announcement today. The capital project has been invoked a couple of times, and while this one isn't the same size of investment, it's as important and as meaningful, I think, because it really focuses on people who have the earliest signs of severe mental illnesses, the people for whom asylums were built in the old days. The first episode of psychosis is like the heart attack of mental illness. It's an immediate, life-threatening emergency. It requires standardized care and protocols. And after that real first episode, there's a tough period where people need time to recover. About 1% to 2% of all Ontarians, over 250,000 of people in this province, will go through this at some point in their lifetime, but almost always in the prime of their life, in late adolescence or early adulthood. The risk of death from this illness is many times higher than that in the general population during this time of life. But early psychosis intervention programs save lives. We know that in Ontario, being a part of such a program reduces the risk of death fourfold. That is massive and one of the best types of outcomes in any type of healthcare in terms of mortality reduction. But while our programs have been life-saving, it's historically been a tremendous struggle for our youth to recover from this scary brain disorder. Our data suggests that part of the reason has been the inconsistent delivery of recovery-oriented care, and for that, many patients, the care that starts too late. There's even huge variability from clinic to clinic, but no longer after today. When, thanks to the Slate family, the Slate Center was established in 2014 at CAMH, we made a promise. It felt loose and aspirational, to be honest. We said that we promised to change the system for everyone in Ontario who's dealing with this illness and put everyone on a path to recovery. So we trained our staff and implemented a program called Navigate, which is a team-based model of coordinated specialty care that prioritizes youth and family preferences, and it's manualized and measurement-based. We partnered with people and family with lived experience like Augustina and Lillian, who you're going to hear from after me. we partnered with an initial set of communities across this province to demonstrate whether we could do this in Thunder Bay, North Bay, and Sudbury in the north, Durham and Waterloo, Wellington, and Niagara in the south, and with our provincial systems support program in Echo Ontario Mental Health, and most recently the Centre of Excellence. And all made possible by philanthropy, federal research funds, and ministry funds from the province. We have done something special because today we are delivering on that promise. Right now, I can look you in the eye and I can tell you that you can get the same evidence-based, team-based coordinated care in all of those 6 communities I just mentioned. For instance, in Thunder Bay, the vast majority of patients in that program are back in work or school, which we define as recovery, previously something unheard of. And if you happen to even move in this province, the team taking you on will pick up exactly where the previous team left off because the program is manualized and structured. So this funding announcement today is extra special, not only for the obvious reason that it will ensure that we'll support the training and implementation of Navigate in every community in Ontario, but for a second reason. Because evidence synthesis and training comes from the Slate Center of CAMH, coordination and oversight from the Centre of Excellence, and the community of practice across this province, we can continuously update this model as new evidence emerges, meaning that in 2030, people will still be getting the same outstanding evidence-based care that is the latest and best care. So this investment cements Ontario as the world leader, not just the leader in Canada, as the world leader through a coordinated system and model of high-quality early psychosis care. We have fully moved out of the asylum because now everyone with this illness has the opportunity for a dignified recovery and the chance to live a meaningful and productive life. Thank you.
Thanks so much, Aristotle. It feels very good to go after the SVP of Research. I feel very important and accomplished, so thank you. Thank you so much. I want to thank you all so much for allowing me to take a few minutes of your time today to share a little bit about me and how I landed here at CAMH. My name is Augustina, and I am a youth engagement specialist at CAMH. I represent the 3% of the population who will experience psychosis in their lifetime. I was hearing voices for 24 hours a day, over 9 months straight. And yeah, you guessed it. It was incredibly stressful and exhausting. A 0 out of 10, I would not recommend it, okay? I had a plan to end my life, but luckily I was able to receive treatment in an early psychosis intervention program, which literally saved my life. I had an entire community supporting me on the path to recovery. This showed me the power of understanding and the support in fighting mental health challenges. Recovery isn't a straight road. It's more like a highway with many interchanges and exits. Sometimes you take a detour, but you keep moving forward. After receiving treatment, I vowed that I would do whatever I could to change the stigma surrounding psychosis. I would talk to anyone and everyone about my experience. Anyone that had an ear, I was going to talk to you about my experience. I spoke at conferences, and then someone at CAMH heard me talk. They asked me if I could help support a new project focused on early psychosis intervention. And of course, I couldn't say no. I thought to myself, I would love to be involved in spreading and scaling this amazing program. And now, 5 years later, I get to be a part of just that. I work casually here at CAMH as a youth engagement specialist, where I get to use my own lived experience to help shape, define, and design and refine EPI research. My story is just one example of how early intervention can transform lives and why this funding is so crucial. I hope to continue supporting efforts to turn patients' lived experiences into real change and reform healthcare. The Slate Center is a leader in early psychosis research and an important partner in scaling and spreading EPI care across Ontario. Together, we are committed to enhancing our system's capacity to deliver evidence-based, standardized care across Ontario. It's important to recognize that both the Slate Center and CAMH truly value the experiences, insights, and contributions of our patients and families. Patient and family voices guide and shape our mission. This new funding for early psychosis intervention means so much more than just providing high-quality care to young people wherever they are. It means brighter futures for our youth, hope for families, stronger communities, less strain on hospitals, breaking the cycle of crisis, building local support networks, and most importantly, it represents a commitment to ensuring that no one is left behind. Now I'd like to call up my friend and colleague, Lillian Duda, Patient and Family Engagement Specialist. Thank you.
Thank you, Augustina. My name's Lillian Duda. have been the family advisory lead on the Early Psychosis Intervention Research Project here at CAMH. I've been at this for 5 years, met Augustina and the team. I am very thankful to be part of this announcement, thanks to CAMH and the ministers and the staff here. I don't have prepared marks, so what you're going to get from me is from my heart. So my son, he had been hospitalized twice for severe mania with psychosis. After his second episode, we were referred to the Early Psychosis Intervention Program here at the Slate Center. And I can honestly tell you it made a world of difference to my family. The care and the support and services put around us helped my son get his life back on track and helped us as a family understand his illness and figure out how we could help. After being through the experience, I agreed to volunteer to be part of the research project because, as Augustina said, I firmly believe that if you are a young adult and you're experiencing psychosis, you and your family should have the same quality of care that I received here at CAMH. And so I'm so proud of the work that they've done. I'm proud to be part of this team of doctors, of scientists, of clinicians, of research staff who are trying to make these services better. And you know, the key for me is they keep the focus on the needs of the patient and their families. And that's why I'm here, and I'm so excited about the funding, and I just know there are so many more families that this will help. And so thank you, and I'm very happy to be here.
So thank you very much, Lillian and Augustina, for bravely sharing your stories. I think you understand our inspiration when you hear them speak. You and your family members are why we are so grateful for the support today. And thank you, Ministers Jones and Tibollo, for being here to celebrate today's exciting announcement for life-supporting mental health care. I also want to thank the many community providers across the province who will make the Early Psychosis Intervention Program possible for patients to access all across our province. And now we will take questions from members of the media. I'll turn it over to Hannah Jensen to coordinate this part.
I'm over here.
There you are, Hannah. There you go.
All right, we'll now take questions from the media. As a friendly reminder, format is one question and one follow-up. Please state your name and your outlet before your question, and we'll move to our first question at the mic.
Good morning to the Minister. Mark McAllister from City News. Despite the long list of programs that the province has come forward with to help people with mental illness, there are still municipalities, big city mayors, calling for more to be done in terms of the trickle down, not-for-profits, other organizations getting some of that help beyond a large organization like this. And in addition to that, Sarah, if you wouldn't mind following up on that and perhaps offering your thoughts on how that can be helped as well.
So in terms of the investments that we are making, of course it will take multiple organizations, including our municipal and federal partners. You know, when we had the opportunity in August at the Association of Municipalities of Ontario to announce the treatment hubs, that is bringing together organizations that have expertise in treatment, whether that is through healthcare, whether that is through addictions, whether that is through mental health, supportive housing. And it is exactly why we are funding a program that brings organizations that have all of those very unique skill sets together to put forward a proposal. And we're getting a lot of interest across Ontario, and they're coming together to make sure that they work collaboratively. You know, we have expertise in a lot of different organizations working across Ontario in various municipalities, and we want those organizations to come together, put forward a Heart Hub wellness model, and then the assessment will happen. But ultimately, it's leveraging the existing expertise that each of those organizations have and individuals need. You know, it is not a case of you only need help for your health care. You only need help for your mental health. You need access to treatment programs. You need access to supportive housing. All of those pieces together will be the treatment hub model. And as we announced in August, 19 of those will be funded. And those centers will then be assessed, reviewed, and ultimately, hopefully be able to scope and scale them to other communities across Ontario. Sarah?
Sure. So I think I'll call up Dr. Voineskos. He'll know more about the 19 million. But I mean, the program we're talking about today is early psychosis intervention, which nearly always starts with somebody requiring hospital services and the specialty services that we get. But so much of that money is invested in other partners, and so maybe Aristotle, you want to come in and describe some of that.
I mean, the focus of the work here is really glue for the system. And what I mean by that is it's really about coordinating care across the province to ensure that no matter where you are, you get outstanding care. Just before we embarked on this project, we did a survey with a number of community providers, and they told us they had a number of key needs that came from them, which were really access to the latest evidence, access to training in a community of practice. Those are their top 3 needs, and that's what this funding is actually going to fulfill. So it's really a shared pot of funding that goes across the province to all 50 or so EPI programs to ensure that we're all providing the same outstanding care, whether you're in Toronto or in the north or in the south. Thank you.
Thank you. Back to the minister as well. You mentioned the heart hubs and the plans to get those up and rolling in the new year. You've had an overwhelming response from organizations that want to be a part of these heart hubs, to the point where you're not going to be able to provide some of that to those organizations. What do you do to sort through who gets it, who doesn't, and so when might they find out, with a deadline coming at the end of next week?
So as I mentioned, there is a lot of interest in many different communities in the treatment hubs. Right now, we are going through those expressions of interest. Ultimately, there will be applications that have very specific, here's what we want to offer in Community A. We will look at both the needs that are happening in the community, as well as how robust and quickly can those organizations pull together and offer the services. You know, there's no doubt that there is needs across Ontario, but we have not been prescriptive in what the demonstration projects must have. There are specific things that they must have, but we are not telling them exactly, because we want to see what the individual communities come forward with. It may be very different, for example, in Northern Ontario than a heart hub model that comes forward in Toronto or Hamilton, and that's okay, because this is about demonstrating different methods to ensure that wraparound service of whether it is healthcare, whether it is access to treatment, whether it is mental health services or supportive housing. All of those pieces must be part of the model, but we're not going to be so prescriptive that those innovative ideas, those creative partnerships can't be included and considered. Thank you.
Hi, this question is for Minister Tibollo. Recently, several of the big city mayors are about to put forward a motion at their caucus, and they're asking for mandatory mental health and addictions treatment. In a scrum recently, the Premier said you were a big fan of that. Can you speak a little bit more about what you're a fan of, what that would look like,
Sure.
and if we can get some others to respond?
Sure. So what I'm a big fan of is treatment and recovery. I really believe that no matter where you are in this province, you should be able to access care and help the individual as much as possible. I think an announcement like today, where we're talking about early psychosis interventions, is extremely important, like are the youth wellness hubs, in making upstream investments to try to start decreasing the amount of need when it comes to the amount of treatment beds that we have available. But one of the things that I am very proud of is the government's investments in the Addiction Recovery Fund, the investments that will be made with the HEART model as well. Why? Because we're increasing capacity. So when an individual needs help, when an individual needs to be cared for, we have the capacity to give those people help. And just recently, the Center of Excellence told me that we've had, because of the new beds that have been opened, just under 300 of the 400 so far, we've had 10,030 unique individuals access those services. So clearly, there is a need for people to get the help that they ask for and that they need, and our government is looking to build that model to ensure that we have that capacity to look after the people when and where they need that help.
Okay, that was a very ministerial pivot of you. But the question again was about the mandatory sort of nature that they're calling for. Obviously, I'm asking this question because it does have, a controversy involved. Can you clarify what your view is on that, since the Premier said you're a big fan of it?
Well, I'm a big fan, as I said, of building a continuum of care that meets people where they are. And what that means is ensuring that there's capacity, and that's an extremely important piece right now, to build capacity to help the people that are looking for help. And we'll continue doing that. We'll continue building that capacity and looking at how we can help more people, because at the end of the day, the more people we help, not just by preventing or reducing the amount of people that need support, we also build the capacity to give them the opportunity to be able to get the help where and when they need it.
Hi there, Alan Hale from Queen's Park today in the Trillium. Mr. Tibollo, I have to ask you to come back to the mic.
Sure.
Okay, so the Premier did say you were a big fan, but he's not the only one who apparently knows your opinion about compulsory treatment. Brampton Mayor Patrick Brown said during his conversations with you about a pilot project he wants for compulsory treatment in Brampton, he said it was very clear that you admire the work that is being done in British Columbia about compulsory treatment. Since you're, and this is a project that is proposing to put people in treatment facilities built inside jails. So considering that your views are apparently very well known privately, can you please explain what about you that you like about the BC plan, and what are you willing to give Brampton its pilot project? And Dr. Aristotle, I would really like to hear from you about whether you believe compulsory treatment is an advisable way of helping people living on the street.
Well, again, I'm going to start off by saying the most important thing we can do is build capacity to give people the ability to get the help where and when they need it. I'm not sure about the BC corrections. I know that in Alberta, they've created a system where, again, it's not mandatory, but it is an opportunity for people that are in corrections facilities to seek out and get addiction support and treatment. And it's having phenomenal success because they can transition out of the corrections facilities into therapeutic communities, which has an incredible result so far, less than 5% recidivism when it comes to crime. When it comes to compassionate interventions, I think that's something that really needs to be studied and looked at. Personally, my opinion is that until we have the system built that allows people to get treatment when and where they are, we really need to continue focusing on that. And that's the focus of this government, increasing capacity, whether it was the Addiction Recovery Fund. I mean, the investments that have been made by our government are staggering, and they continue to build a continuum of care that not only looks at the treatment component, but the withdrawal management, the interventions with respect to supportive housing, and how that carries over eventually into transition and giving people the opportunity to get a job, to go back to school, ensure food security. These are all aspects that our government is looking at, because we know that if a person is going to recover, we have to provide them with those resources.
Well, I mean, we already have a mental health act in this province, and it's something our doctors use very judiciously and cautiously. And for those of you who aren't aware, I mean, this is really when someone is suffering from such a severe illness that it puts themselves at very high risk to their own person or to others. And that's a test that every doctor has to think about when they meet a patient in hospital or in their clinic. So it's really hard to answer a question about everyone out on the street, because there's so many different roads, so to speak, to getting there. And it's possible that a small subset would meet that test if we evaluated them in hospital, but there's many people who probably wouldn't. So it's a really tough question, and I think at this point we have the tools that are available to us to really help people when they're at serious risk themselves or others.
I have a question for Minister Jones. Earlier this year, in response to the Auditor General's Green Belt report, the Minister's offices were instructed to begin storing records received from lobbyists and other third parties that have been, or could be, used in policy development in a central repository called OPS Docs. A colleague of mine FOI'd records from staff in your office about what they had put into this repository in mid-August, and was told that there was none that could be found. Is your staff using this third-party materials repository after it was implemented, and if not, why?
We are implementing it, and we have been. So, as you know, FOIs are a moment in time. I can assure you that the ministry staff are complying with the Auditor General's recommendations. Thank you.
All right. Are you good? Okay, and that concludes our question and answer period. Thank you everyone for coming.